Dr. Eric, the fitness physician. Happy Thyroid Thursday, of course. And last time I did a little talk about thyroid deficiency and the differentiation between a deficiency and actually true what they call hypothyroidism, which has been turned into a laboratory diagnosis. But of course, we all know it's a clinical diagnosis like most diseases or issues or imbalances. So we're talking about deficiencies. So I'm going to continue on just a little bit. I'm going to do a little graphical one representation. I'll do like a keynote to kind of lay it out there because it'll look better than my lovely handwriting. So deficiency, talking about what can happen in terms of clinical versus laboratory analysis. So kind of the classic scenario, right, is that we have decreased thyroid production. Our glands are not making enough thyroid hormone, which is what we call T4 and T3. And then when that happens, another laboratory marker goes up, TSH. That's what's secreted in the brain. It's a feedback mechanism. So our body's smart. It basically senses that. So our brains can tell the pituitary gland to secrete TSH, which then tells the thyroid gland to pump out thyroid hormone. So if it's not pumping out enough, it's kind of like your body saying, hey, yo, brain, we need to make more thyroid hormones. Therefore, TSH will go up, and then it'll kind of kickstart, give a little kick in the butt to the thyroid gland to pump it out. When that doesn't work, if it's dropping, that typically goes up, and that's a sign of hypothyroidism, and vice versa. Now, there are other scenarios where this will not happen as much, or it'll be blunted, or we'll get into this later. But the bottom line is if you have decreased conversion of T4 to T3, or you have a decrease in receptor site sensitivity, in other words, it's going to the cell, but it's not signaling anything, kind of like what you hear about a lot with insulin resistance. You can get resistance to thyroid hormone. When these things happen, the TSH doesn't change because in the brain it senses everything's normal. So it's pumping it out, it's floating around in the system, but in the cell, again, we talk about things at the cellular level, it's not getting in. Either T4 is not getting uptake, there's no uptake of T4 into the cell, the decreased sensitivity, so that the hormone is knocking on the cell's door, but nobody's answering, or T4 isn't getting converted into T3. We talked about before how that's the active hormone is the T3. And you'll go to your doctor or you'll go to someone else and they'll say, oh, well, your TSH is normal, you're fine. But doctor, I'm tired, I'm cold, I'm constipated, I'm fatigued, I'm gaining weight, I'm depressed, etc. Oh, well, your lab's normal. Well, that's what's happening a lot. Again, we're not treating the patient. They have a clinical scenario of a thyroid deficiency, even though on paper by labs they're not hypothyroid. So that's the difference. So again, this is one of the many things. There's several syndromes, but one of which is the low T3 syndrome, where you don't have enough actual hormone, which is the T3, the active form, which is the T3. You may have T4 floating around, TSH is okay, but the T3 is either not there, or it's not getting in, it's not being converted, or it's just the cell's just not answering the door. So those are very important distinctions, and we see this all the time, not only with thyroid, but with other hormone issues as well. So thyroid deficiency is a clinical scenario and a clinical diagnosis, and therefore a clinical treatment. So these are some things. I'll dig into this more, and I'll do some videos to explain this in a graphic representation so you can see some cool pictures and stuff like that too. So again, it all comes down to what you're hearing from your patient, the history, the questions, and the answers to the questions you're asking them, what you're seeing on your exam findings, and much, much more. So I'm all about hormonal fitness and muscle medicine. Guys, reach out to me if you any questions about thyroid, adrenal glands, testosterone, progesterone, estrogen, growth hormone, and anything else related to muscle growth and hormone optimization. I'd like to answer those questions for you. So reach out to me anytime. Check me out at drericprimex.com. Everyone have a rocking day, and we will talk to you soon.